Here with success stories. Joining me today is Bill Sapansky from Team Select Healthcare, and we are here to talk about the PCS care that's provided by parents during the pandemic, and then as well in other states that do have parent-provided programs. Welcome, Bill.
Thank you. Thank you for having me.
So, Bill, tell us a little bit about Team Select Healthcare.
So, Team Select, we are a private duty nursing and also home health agency. We mostly work with pediatric clients on the private duty side, some adults, but mostly kids. And we have about 40 locations in 11 states currently.
Wow. So 40 locations, 11 states, and so you work with about how many families overall?
For the parent caregiver program, I would say it's about 1,000 in the 6 states that we have this program in currently. Overall, it's several thousand that we oversee for private duty nursing, and then we also have a home health side that works with seniors through traditional Medicare, and they work primarily in Arizona and Colorado.
Okay. Wow. So you cover a lot of families. That's
Mhm.
incredible. Wow. Okay. So Bill, what was the caregiver climate like before the pandemic? You're talking about, there's the private duty nursing side, but there's also then the personal care services side. What has been the caregiving climate with the personal care services side?
Well, I would say both for with private duty nursing, and then also if you had any personal care, it was very tough before COVID. Um, I've been in this industry now since 2005, and I would say every year since I've been in this industry, it just seems that the shortage for nurses and aides have gotten just worse and worse. We started to see it obviously in the rural areas, and then it spread to suburban and into urban areas, and then just everywhere. It just got worse. And COVID really just kind of took gasoline and doused it onto the fire. Um, we were expecting a silver tsunami, so we were expecting not only a wave of individuals needing more care, but also a wave of individuals retiring. But COVID just expedited that situation. It's something that maybe we would see more in the 2030s. We obviously started seeing in 2020 and then some, but it's been a slow process, but it's always been there. And I believe, according to the National Institute of Health, since 1980, the average mean or the average age of an RN has just gone up in the United States, not down. So that just tells you that we're not producing enough nurses to replace those who are leaving or retiring. And so it's just been a constant struggle. But aides especially have always been a constant struggle due to the fact too of the rates that we can that we're reimbursed and then that we can pay to those aides.
So you're saying that with the aides, the rate of reimbursement, because an aide, for instance, a personal care service provider, they're trained by the healthcare agency, by the home care agency. They don't if they're just a personal care service provider, they don't necessarily have a degree.
Correct.
They're trained on the job. They go through specific training, and you're saying that the compensation that they're given, that you're able to give them, it has been a problem to recruiting them.
Correct. Even before COVID, it was an issue because aides typically were making, in a lot of states, unfortunately, just above minimum wage because our reimbursement as a provider was, anywhere in most states for personal care services for in the low teens to mid teens at the most. And so, unfortunately, we weren't able to then pay an employee that much. And so a lot of these individuals could then go and work at Amazon or could go work at a fast food establishment and make more than we could pay. So it was already a challenge. And then now, just like everything has been exacerbated, everything's inflated in regards to wages and that. So now, to pay individuals those wages, you can't find anyone. And our rates, unfortunately, our reimbursement rates were not increased. One thing I always tell people to keep in mind with home care agencies is that we are relying on Medicaid and sometimes Medicare, but especially Medicaid for our reimbursement. We can't just raise our reimbursement when we want to.
Right.
We have to have the legislature approve it. And anyone that has worked with legislators or a state legislature knows that that is a challenge and it takes time. And so, unfortunately, does not always keep up with the times.
Right. So what then you're dealing with is that you're trying to hire personal care service providers. They have to go through some somewhat rigorous training
Mhm.
and keep up with annual compliance
Yeah,
and perform tasks that range from, taking, you're changing diapers, you're toileting, you're dealing with
sure.
soiled bedding, soiled clothes, you are dealing with, you know, transferring, and helping individuals ambulate, to feeding, dressing, hygiene, everything. Okay.
Mhm.
Laundry. I mean, you're talking about everything. Okay. And then and then you have to pay them less than they can go to McDonald's and make.
Correct.
And they don't have to go through all that rigorous training, and they don't have to deal with dirty diapers and soiled
Yes.
bedding and all that stuff.
Yes.
And so that's why there's nobody, essentially.
Correct. Yes.
Because
Yes.
it really takes it's really a skilled position. Okay. It's very much a skilled position, and there's no skilled pay for it. Okay.
Correct. Yeah. Aides and nurses, what I always describe as they're the oil to in healthcare. They are what gets keep the engine going and keep everything. Without an aide, we see what's happening in the hospitals. Nurses right now in New York City are striking. They're striking because they're not only being overworked, but they are now having to take on the work and responsibility what aides would do, because there's no aides because they can't pay them enough.
Right.
So now, the nurses who are already overworked are asked to do all these other tasks that you had just listed, and
Yep.
they just can't. They're literally overtaxed. And so that's what we're seeing in the issues in healthcare. But it's always exacerbated in home care because we're always historically been lesser reimbursed,
Right.
and then that means there's unfortunately less individuals that we can choose to hire because of that.
So then here comes the pandemic, and all agencies then were tasked with saying, how can we make healthcare accessible during this time when it will be harder to get healthcare? And one of the things that CMS, Centers for Medicaid and Medicare Services, did was they said that parents and spouses of special needs individuals could be hired by the home care agencies. They have to meet all the same requirements, be trained by them, be supervised by them, fulfill all their annual compliances, um, and clock all their shifts in the same way, the whole bit. Okay. And they could do this under the home and community-based services, which federal legislation in home and community-based services specifically states that parents and spouses cannot be paid caregivers. Okay, so this was basically a waiver that states could apply for. And so now you have a whole host of states where you have parents that are providing this care and spouses that are providing this care, and there are no replacements. Okay. It right now, okay, so you service 6 states with paid parent caregivers. Okay.
Mhm.
5 of those states have their own programs. okay, that allow parents to do this on a permanent basis. One of those states is operating under a COVID waiver. In all of those states, if you did not have the parent paid caregivers, would you be able to replace those parents in any of those states?
No, sadly, no. Um, it just wouldn't have occurred. That's why we started looking at this model and trying to expand it. We have been in business since 2008 and been working with those who are medically fragile since 2012 who need like private duty nursing care. Um, and about 5 years ago, we said, why aren't we doing this in other states? We started this out in Colorado. That program has been going for almost 25 years now. And so we started looking at other states to try to expand this and work on this. But to your point, no, we couldn't. Um, the it used to be the issue for years. Like I said, I've been doing this for a while. We're asking for rate increases, and we still do need rate increases to just maintain what we have. But rate increases are not going to get us bodies, and what we need are individuals who can then fill the spaces that we have available. We have clients in many states that are sitting in the hospital not only for months but years because they cannot discharge home because there's not adequate care at home. And so that's the issue, is that we just do not have enough resources to go around to fill all the needs that are out there for these individuals currently. And so, yes, it would be, if this wasn't allowed, it would be tragic to these families.
And so you would have 1,000 families without caregivers, okay? And
Mhm.
when families don't have caregivers, have you seen on these programs, both under the pandemic waiver and in the 5 states that have permanent programs, have you seen in these families the quality of care, or actually the health of the patient, increase, be better?
Oh, yes, very much so. So, you know, let's just be honest. Nobody can provide better care than a parent. You know your own child. You know your child the best, and the parents already know how to do these tasks. When you go home and you're discharged from home, you have to know how to care for your child.
Mhm.
So you already
Right.
know how to do these tasks, and they're already doing them because they don't have care. But what we do by having programs, we call these family CNA or family home health aid, depending on what they call it in the state,
Mhm.
or licensed nurse aid programs. Um, it's teaching the parent not necessarily the skill, but it's teaching them why we do what we do.
Mhm.
So they know why we wear gloves. Why do we worry when the fever is at this temperature and not
Mhm.
this temperature, and what to do about it? And even when you're not on the clock per se, you still have that knowledge.
Mhm.
And every parent that I've spoken with, for example, in our Colorado program, they told me, they said, Bill, before then I didn't know when to freak out and when not to.
Sure.
And now I do.
Sure.
Now I understand it and I have that knowledge. Also, in a lot of these states, not only does the parent allowed to be a paid caregiver or guardian, but also they allow family members and a lot of times family friends as well. So then you're choosing who can be in your home.
Mhm.
And that's a lot of times the issues that we see in the home is you have individuals coming in your home that you don't know,
Right.
and you don't know how well they're. Yes, they're a nurse, but do you know that they know your son or daughter, or how well their skills are?
Right.
Instead, you know that these individuals that are coming in are people that you trust, that your son or daughter know, and that they're able to rely on. They're not calling off. They're there. You have the built-in network that you need in order to help care for your son or daughter, and that's the most important. And so we see hospitalizations, typical hospitalizations are anywhere from 8 to 12%. And I don't mean rehospitalization, I mean just hospitalizations on a monthly basis are 8 to 12% in this population. that we currently service under a private duty nursing plan. And industry standards 15 to 18%. So we do pretty well. But under a parent CNA program like they have in Colorado, our hospitalization rate is 0.3 to
Wow.
0.6%.
Wow.
And if you think about that, the cost for these children is not really the care that we provide. The real cost to the state, because state's cost for these children is up to 40 to 50% of their actual Medicaid spend on an annual basis. It costs them $4,200 to keep these children in a hospital on average in this country. And of course, depending on where you're at in this country, that's even more than that. So if you're able to cut those hospitalizations down, that cost that you're saving the state is huge. And then you're able to instead reinvest that money into nurses that have to work on higher acuity cases, like those who are 24/7 ventilated,
Mhm.
and get them cost of living adjustment. You can also invest in scholarships to get more nurses into the field, things like that. So there's a lot of cost saving measures here that can then that money can be recycled and used for other things that can help not only our industry but other industries in healthcare as well.
Wow. So not only then does paying parents as caregivers reduce the healthcare cost of the patient, but then also I would say then that if you are compensating those parents, then they're going to be less dependent on the welfare system.
Very much so. So one statistic: 80% of marriages that have medically fragile children end in divorce, which is very sad. And so what inevitably happens is then mom usually becomes the sole caregiver of that individual. Mom and dad split up, and then mom is usually cannot hold down a consistent position because
Mhm.
staffing's not available, so she
Yep.
has to stay at home with her child, and so then she has to rely on government assistance to help make ends meet. And so yes, with this position, excuse me, with this model, what we do is we not only train an individual for free to become an aide. Then what we do is we pay them. They get full benefits with us. They can get 401k, and so they then start paying back into the system. And so that's also another cost savings for the state. It's also a savings for the state. And a lot of times the state doesn't think about this time to kind of point this out. Is that when I was an administrator, I spent 90% of my time on 5% of my client census. And what I mean by that is you were dealing with issues, not
Hmm.
having nurses, not having staffing, you're dealing with complaint
Yep.
calls. When you have this program in place, you don't deal with those calls anymore because those issues are non existent. So those calls go away. So that
Right.
frees you up the time to be able to do what you're supposed to do, which is manage your cases. Our
Right.
case managers have the time to go out to manage their cases, but the case managers at the state on the Medicaid level can go out and manage their cases. They can go out and actually supervise and look over and review what they're really
Right.
supposed to be doing instead of being tied to the phone. So it's
Right.
also great for the state because they're able to see greater satisfaction from their case managers because their case managers are then able to get out and see their kids instead of having to be tied to a phone.
Right. So, okay, so then with a paid parent system, the patients are healthier, the families are using less welfare programs, so saving
Mhm,
welfare dollars.
mhm.
They're being compensated, so now they're starting to put tax revenue, in the form of withholdings and things back into the system instead of
Correct.
draining the system. Um, the tension in the homes goes down, so you have less of those households splitting. Okay, they're staying together. And so when anytime you have a divorce, your welfare costs just go up, you know, uh, exponentially. So you're talking like uh you're saving money all the way around with this stuff.
Mhm.
Okay. Um and so if home and community-based services, if that sector of Medicaid would allow this or make this a permanent situation, because right now the waivers that one of the states that you service, the waiver that they have, the waiver that my state has, the waiver that most of the states have, expire when the COVID public health emergency expires. And then that makes all of these households, all of these thousands upon thousands of families without caregivers. And then we're without compensation. We start leaning more on the welfare system, taking from other welfare programs, and trying to figure out where our income is going to come from, and how we're going to make the ends meet. Then the patients get sick more often. Our loved ones get sick more often. Healthcare costs increase. So if home and community-based services if they would just make an interim rule and saying, okay, we know that legislation says that, federal legislation says that, this is not, that parents and spouses cannot be paid caregivers, but we're seeing this is a good thing. And so we're just temporarily going to, because this is its own public health emergency, we're going to make a temporary rule that allows us to continue. Would you see that as in the best interest of the society of our nation as a whole?
Yes, yes. Under the HCBS waivers, or home and community-based waivers, there's several of them, and only one of the waivers is going to be allowed. It's called a 1915C waiver. That is the only waiver that's going to be allowed permanently to allow parents to be paid caregivers. But our belief is that all the waivers should allow to do that. Also, we feel that currently CMS, which is the Centers for Medicare and Medicaid, have a rule. If you have private duty nursing, but if what's called a state plan, or state plan and waivers, if you have a state plan, they say that their legal opinion, it's not even written, their legal opinion is only an RN or LPN can provide that service.
Right.
And so we feel that they should, change not only that legal opinion, but also allow under HCBS permanently to allow parents and spouses and guardians to be paid caregivers. There needs to be structure around that, but that needs to be allowed under there. And that's something that, CMS can do now, that really is not a huge lift, or also a lot of costs that are associated with that. So yeah, I believe that that's something that needs to be done too. I think there's a lot of things, there's a lot of investments that both the state and the federal governments need to make in healthcare right now when it comes to workforce. But there are some things that are from an administrative standpoint that they can do very quickly, and those are one of them.
Right. Okay. So I know that we've got like 6 minutes before we get shut down here. Okay. So real quick, what I've been telling Medicaid for 13 years, you should be paying parents to do this. Okay. This is ridiculous. Okay. All the staffing shortages, you practically can't work. Okay. So, and one of their concerns to me is, well, when paying parents opens up the opportunity for fraud and abuse. Have you seen, in all of your experience, have you seen a trend among among paid parent caregivers of abuse or fraud?
No, actually not. So let me tell you how we do that. One is we have an EVV. We have EVV in most states, so that's electronic verifiable visit. So also we have with Team Select, and I know many of my competitors have the same, is we have an app that you can use on your phone, and that's how you sign in.
Yes. And
you sign out. It is actually where when you clock in, when you sign in, it clocks you in, and when you sign out, it clocks you out. If you forget to sign out, you have to write a note to us in the office. We have to review it. We call you. we document it, then we change it. So it's everything is documented, everything
Mhm.
is regimented, based off of the care plan that is written by the physician and by our nurse. And that way, everything is task based in order to make sure everything is completed and done. I would say from the abuse standpoint, it actually, the abuse issues go down dramatically because the parents are actually getting the care they need. And it's not just
Yes.
being provided by them, but they can then hire other individuals that they know, like I said earlier, and they can hire those individuals to come in. So individuals like yourself, Nathan, could, be able to go to Costco on a Saturday,
Right.
and be able to do that while, your sister's watching your son or whatever. You have those options available. So usually when we see abuse and that is because there's so much stress in a home, there's no outlet,
Mhm.
and the parents don't feel that they have any more outlets or anything available to them. We are giving parents options where now they have options and control back of the care over their child. And so they're able to allow who they want in their home, and they're able to, with the help of the agencies, put a schedule in place and actually have a care team around their child,
Mhm.
like they were promised when they were brought home. So yeah, the issues, I do hear the concerns, but we don't see the issues, the fraud, abuse, all those different, we just don't see them because the parents also know too, like if you ask our Colorado parents or Arizona parents, they know what a gift this is to be able to do this program,
Right.
and they're not going to do anything to jeopardize that either.
Right.
They know that not all states do this.
Right. And because they're being compensated, the tension in the home goes down. You have
Yes,
you have this income that you know is coming in. Whereas when you don't
yes,
have that, it's like you're having to provide all this care and then try
yep,
to figure out how to work on top of that. And
yes.
that provides that creates a tremendous stress.
Cor-
Okay.
Correct.
So
Yeah, I would just always tell everybody, if you don't have a medically fragile child, think about this. Your home is your sanctuary.
right,
When you have a medically fragile child, as Nathan knows, you cannot escape that.
right,
So having that stress just compound, then the next people that that we see get taken out on is usually us or the case manager or the nurse.
yep,
And so the thing is that being able to relieve that stress where parents feel that they have control again and they have say over their child's care, which we all want, that's huge. And to be able to have financial
right,
independence is huge too.
right. Huge. Okay, so we're down to like our last minute and a half here, Bill.
Sure.
Real quick, if you could say one thing to CMS and Health and Human Services about this parents and spouses being paid, um, what would you say in 30 seconds to them?
I would just ask them to put themselves in your shoes or other parents' shoes. If God forbid this happened to them, what options would they want available to them? And I don't think anybody would disagree with us saying that they wouldn't want this available to them. And I think that's the thing. We need to give parents options, and that's all we're asking from CMS and the states, is to give our parents options to care for their kiddos.
Perfect. Thank you so much, Bill. Much appreciated.
Thank you.
And CMS, HHS, as you watch this, please make this an interim rule. Let us parents continue this care. We've shown in the last 2.5 years that we can do this.